The rise in COVID cases, it's concerning for a doctor in charge of Vanderbilt's ICU. He says the problem stretches farther than the lack of hospital beds. There may not be enough staff to care for sick patients. News 2's Alex Dennis explains the 1-2 punch facing medical personnel.
The last 7 to 10 days or so, we've seen increased numbers from Davidson and Williamson County coming in through our own emergency department. That's in the ICU. The hospital numbers are even higher than that. They're 4 or 5 times that and obviously going up.
As the director of Vanderbilt's Medical Intensive Care Unit, Dr. Todd Rice faces 2 challenges.
And so it's kind of this double hit. You get hit from there are more cases, but then you also get hit from and we have fewer people right now to take care of those cases.
It's a problem people may not consider.
As the number of cases increases in the community, the number of our employees that are positive also increases,
forcing teams of specialized professionals to stay home.
We have shortages of our nurses and our nurse practitioners and our respiratory therapists, et cetera, because some of them, unfortunately, even if they're vaccinated, have tested positive and they're out of work for 10 days.
Dr. Rice says while the virus is keeping people extremely ill to the point of isolation, that's not its intent, because the virus actually needs its host to stay alive for it to thrive.
From an evolutionary standpoint, the virus, it's bad for the virus to kill people because then the virus doesn't spread as well. So what's ideal for a virus is to make you sick, cough, sneeze, because that spreads the virus, but not isolate you or kill you.
He hopes further mutations will cause less severe disease.
We haven't seen all of that with COVID, but it wouldn't surprise me if we deal with this virus for a long, long time, but it starts to become more like the common cold than something that is hospitalizing lots of people.
Until then, he braces for another wave of COVID patients. Alex Dennis, News 2.
Now, because of staffing shortages, some elective procedures are being postponed like they were in 2020.